We wanted to address a few of the frequently asked questions that we receive. And the first one relates to the timing of ovarian cancer screening or removal of the ovaries in individuals who have BRCA1 and BRCA2 mutations. So first, ovarian cancer screening is challenging right now. We are really hopeful that we will have improved techniques for ovarian cancer screening. But at this time, we're left with a blood test called a CA125 and then transvaginal ultrasounds to look at the ovaries. Unfortunately, neither of these tests work particularly well, and there are a large number of false positives in addition to false negatives. For that reason, it's really a discussion with you and your doctors about whether or not to do these tests, as they're not honestly particularly valuable. What's more important is the timing of removal of the ovaries. So for BRCA1, the risks of ovarian cancer are higher and the cancers occur earlier. And for that reason, risk-reducing salpingo-oophorectomy, which is the removal of the fallopian tubes and ovaries, is recommended between ages 35 and 40. For BRCA2, the risks are lower and a little later, so we generally talk about that surgery between ages 40 and 45. There are ongoing studies regarding removal of the fallopian tubes only, but these are really based on studies. And we do encourage people to talk with their doctors extensively about this because we do not have data to suggest that it's equivalent to removal of the ovaries. In addition, a lot of women want to know about the whether or not to remove their uterus, and that depends a lot on their personal situation as well. The standard of care, though, is ovary and fallopian tube removal at the ages that I mentioned. A second question that we received is related to how frequently individuals of Ashkenazi Jewish ancestry with different types of cancers are likely to have a BRCA1 or 2 mutation. So as a reminder, people of any race or any ethnicity can have a BRCA1 or 2 mutation. It's been found in all races and ethnicity. But in individuals who are of Ashkenazi Jewish descent, there are 3 what we call founder mutations that are much more commonly seen. And the chances that a person of Ashkenazi Jewish descent has a BRCA1 or 2 mutation is much higher than in the non-Ashkenazi population. So individuals of Jewish descent, 1 in 40 has a BRCA1 or 2 mutation. If you're a woman with ovarian cancer who's of Jewish descent, you have as much as a 1 in 3 chance of having a BRCA1 or 2 mutation. If you have breast cancer, it's 1 in 10. If you have breast cancer at a young age, it's 1 in 5. So you can see why this really matters. We also use Ashkenazi Jewish ancestry when we're thinking about prostate cancer and pancreatic cancer to consider testing. We have had a lot of questions also about the option of preimplantation genetic testing. Just as a reminder, preimplantation genetic testing is when a couple goes through in vitro fertilization and screens those embryos and only reimplants in the uterus embryos that don't have a BRCA1 or BRCA2 mutation. As you can imagine, this is complicated. It can be expensive. And even for a healthy young couple, just because you're screening embryos and some of them you're not using, it can be a process which does not result in a pregnancy. And so it can be very stressful. So balancing out those issues of cost and how challenging it can be to go through the process, balancing against whether or not to go through this so that the embryos do not have a BRCA1 or 2 mutation is a very, very personal decision. And so I can certainly tell you that for sure that not everyone does this, and that it's very personal, and it's something that couples really need to work through, and we're happy to help you do that. Another question that's been very common lately is about COVID vaccines. And I'd like to emphasize the position that everyone should get a COVID vaccine when they are able to do so. There is nothing specific about having a BRCA1 or 2 mutation that either makes an individual more likely to get COVID or be sick from COVID. And also, there's nothing about having a BRCA1 or 2 mutation that it's a contraindication to receiving a vaccine. The biggest thing that we look for before administering vaccines are severe allergies to very specific medications, but that's part of the screening process when you go to get your vaccine. It's very important that as many people get vaccinated as quickly as possible so we can put all this behind us.